Hello, I'm Dr. Singh. I'm the CEO at Access Healthcare Physicians, and I'm very proud to have Dr. Danish Siddiq, infectious disease expert, in our studio. And I would like to ask Danish, thank you for coming.
Oh, thank you for having me.
I know you're at the front line of this COVID pandemic. How do you feel about it?
So it's a mixture of trepidation and an immense sense of responsibility. So we've all been thrust into leadership roles and where we work and how we do things. And looking at our community as a whole, most physicians are used to dealing with patients on a one-to-one level. But now we're dealing with the community level, with the county level, with the state level. And we're not prepared for it, but our medical education helps us deal with these kind of stressors and take them on head on. And it's one day at a time. We wake up, go to work, take care of our patients, and get back home and try to make sure that what we do is in their best interest. And things are changing very rapidly. I think that's the biggest thing we have to keep up with.
What has been your biggest challenge during this pandemic?
So if there was one, I would tell you about it, but there are actually multiple. And, firstly, learning about a completely new disease, how to address the new disease. All of us are inherently wanting to treat our patients. So what can we give to them to help them and help them get better fast? Then on a bigger level, looking at our hospitals and our clinics, how to make sure that we as physicians are safe, our patients are safe, our providers, our medical assistants, everyone who comes into contact are safe. So in Access, we've worked on policies as to how to make sure that there were certain triage centers, and we would call patients, check up on patients, make sure that people coming in had the adequate personal protective equipment on them. The providers had the adequate personal protective equipment available. Testing, how to test people, and when to send people to the hospital, deal with them in the hospital. But, if it all boils down to, the biggest challenge is dealing with our sickest people in the hospital. How to make sure that we provide them support, provide them the newest cares that are coming, and making sure that we get them through this.
So you're not only leading our care for patients, you're also protecting our physicians, you're protecting our community. You're really at the top of the chain right now.
It's not just me, and I think that's where we need to highlight that it's not just physicians. We end up being on top of the chain, but it starts off with even custodial staff, the EMTs, who are the first responders, the ER staff, the critical care doctors, anesthesiologists. I think the most underappreciated are respiratory therapists, because them and the anesthesiologists are the ones who are actually, sometimes if people can't breathe, intubating them, and they're being exposed to this literally in their faces. So it's a big team effort. It's not just one person, and I surely don't think that I would be, we're standing on shoulders of giants, so I would not be anywhere if we didn't have the support of the staff that we have.
Yeah, so supporting our healthcare professionals is so important. If you have one message for the members of our community, what would you tell them?
So, interestingly, if you look back at history, and that's where we learn a lot of what we do, is just going back 100 years, because this thing we're experiencing is almost like a 100-year pandemic. When the Spanish flu hit the U.S., there were certain strategies, certain different cities used. You must have seen this on the internet with this meme of flattening the curve. It arose from how Philadelphia and St. Louis approached the Spanish flu, where Philadelphia did not shut down anything and everything continued as business as usual. And St. Louis quarantined, shut down sports events, parades, everything was shut down. And the difference in death was, that's the only thing they had back then to look at death rate. They didn't have any of these fancy tests that we have now. And you had a very high rate in Philadelphia and a little bump. The whole spike turned into a little bump in St. Louis. So just mitigation strategies. So the biggest thing that the community can do is the social distancing. So if we do not spread the disease, and here's where, thankfully, 80 to 90% of the people who get the disease aren't very ill. They can be mildly ill, have some flu-like symptoms, a little shortness of breath, like a regular cough and cold, and they get over it. But they can spread the disease. And we don't have a vaccine for it, so we can't immunize people against the disease. So if we slow down the spread and let it go through the community slowly, we have lesser death. Our healthcare system doesn't get saturated. The ERs don't get full, and our hospitals don't get full. So the healthcare system makes it through smoothly as well in this time. So it is very important, and luckily, at least in Hernando County, our hospitals are not dealing with what you see in the news with happening in New York and other big metropolitan areas. So I think we're doing a great job at that we're socially distancing. Our senior citizens are wiser and they're listening and they're staying sheltered. Yeah. And that is making a difference. So that's probably the biggest thing. Then washing your hands, covering up your face, that is also key. Initially, I know there was a little controversy where face masks, initially they weren't saying everyone should wear it, but they have flipped how we deal with it because of the rate of spread. Now you have to pretend like you have the disease. If you feel like you have the disease, you do things differently. You cover your face, you make sure, you're not shaking hands, you're staying away from people so that you don't spread it. And that approach in itself will slow the spread of the disease down significantly. Washing your hands for 20 seconds, saying happy birthday with soap and water is good enough. And just try to maintain good hand hygiene and stay socially distanced. Listen to your health departments. Don't go back to business as usual unless you get guidance to, limit the social distance.
So are you saying we cannot stop social distancing on May 1?
I would wait. I would listen to the healthcare experts. And again, it is a phased response that they're looking at. So they will let certain businesses and essential things come back. But I still think that we need to be cautious. And again, looking back at history, the Spanish flu did have a second wave. And that is what we are looking at right now to make sure that doesn't happen with coronavirus.
You are seeing healthcare professionals undergo a lot of stress with this. What is your advice to them? Are there any helplines, resources available to them?
Yep. So personal experience, first talk about me, myself, and my wife is also a physician. We're not as busy as we usually are, thankfully. So we see, as an infection doctor, I'm fairly busy, but we actually see much more patients in the hospital under normal circumstances. The hospitals are not near capacity. But we're more tired, we're exhausted, and me and my wife were talking about it. It's the emotional toll that it's taking on all of us, and I talk about that pretty frankly. It's almost like, it drains you emotionally, not physically, but you still, that affects you over time. So, as you know, doctors make the worst patients. Yeah. So we think, we're infallible and we can keep going on, but it is very, it is good to lean on other physicians, talk to other physicians, talk to your family members. Now we have time, all the time in the world to spend with our families, and there are various helplines that you can call, and we will provide numbers for that. Florida Blue has a toll-free, confidential helpline for healthcare providers, as does Doximity, which is an app that a lot of physicians are using, which is providing people counseling services and how to deal with this pandemic and the stressors involved with it.
Danish, it's been amazing listening to you. I learn every time I talk to you. You have so much to tell our patients and our community. Thank you for joining us today, and we would love to have you again and again in our studio. Be safe and be strong.
That was very kind of you. Thank you very much for having me.